Hi guys, I'm Alex Burlock. For my topic today, I'm going to be talking about assisted suicide and euthanasia. So assisted suicide and euthanasia are both the pain-free death of a patient suffering from an incurable disease or from an irreversible coma. This is done by taking lethal drugs provided by a doctor. This is illegal in all but 5 states in the United States. In Oregon, Washington, and Vermont, it is legal when the patient has 6 or months left to live. In Montana and New Mexico, the decision of using the Death with Dignity Act is under court decision, meaning that when a person wants to be given the life-ending medication, they have to go in front of a judge, and the judge then decides whether or not they can be given the medication. Assisted suicide is the suicide of a patient suffering from an incurable disease. This is done by taking lethal drugs that are provided by your doctor. Euthanasia is the painless killing of a patient suffering from an incurable, painful disease or a patient in an irreversible coma. The difference between assisted suicide and euthanasia is that assisted suicide is when your physician prescribes the medication secobarbital or phenobarbital, which are lethal drugs used by doctors. Euthanasia is when a doctor injects the lethal medication. First, a coma is induced by an overdose of barbiturates. Then, this is followed by a muscle relaxant. The patient usually dies when the diaphragm stops contracting or the heart stops beating. Sometimes death is delayed. When this happens, potassium chloride is then given to cause cardiac arrest. Both euthanasia and assisted suicide are pain-free to the patient. So assisted suicide and euthanasia helps end the suffering of the patients and their family members. As I know from personal experience, it is very difficult to watch someone you love die from an incurable disease. The Death with Dignity Act allows terminally ill people that live in certain states end their lives through voluntary self-administration of the lethal medications that are prescribed by their physician. One person that became very well known for using the Death with Dignity Act is Brittany Maynard. So I'm going to show you guys a small video real quick.
When people criticize me for not like waiting longer or, whatever they've decided is best for me, it hurts because really I risk it every day that I wake up. And I do it because I still feel good enough, and I still have enough joy, and I still laugh and smile with my family and friends enough that it doesn't seem like the right time right now, but it will come because I feel myself getting sicker. It's happening each week. I still get out and do what I can. I walk with my husband, I walk with my family and my dogs, and things like that bring me the greatest feelings of health that I have these days. But really it's been just since January 1st, since my diagnosis, it's like health-wise things keep just getting worse. But I guess that's what happens when you're terminally ill, is you get sicker and sicker.
It sounds so cliche, we take things one day at a time, but it's like that's the only way to get through this. You take away all of the material stuff, all the nonsense that we...
Okay. So that was just a small clip of a video of Brittany Maynard. So Brittany Maynard was 29 when she was diagnosed with stage 4 glioblastoma, which is a brain tumor. She had surgery and the doctors removed as much of the brain tumor as they could, but it grew back larger than it was before 2 months after the surgery. The MRI I have on the screen has the tumor outlined and run, which gives you guys an idea of how large the tumor was. So right here, that's how big her tumor was. It was taking up her whole left frontal lobe of her brain. So it's a significant brain tumor. She decided not to go with the chemotherapy and radiation because she wanted to live the rest of her life and to the fullest without any of the effects of the medication. She said, "Because my tumor is so large, doctors prescribed full brain radiation. I read about the side effects. The hair on my scalp would have been singed off. My scalp would have been left covered in first-degree burns. My life as I knew it would be gone." Maynard had decided that Oregon's Death with Dignity Act was going to be her option. She was currently living in California, but then moved to Oregon with her husband, mom, and stepfather so she could use the Death with Dignity Act. Maynard said, "They try to mix it up with suicide, and that's really unfair because there's not a single part of me that wants to die, but I am dying." She did not want to die, but she accepted the fact that she was going to and felt that dying when there were some good memories of her life left will help her family mourn better. Brittany Maynard is just one example of how using the Death with Dignity Act helps end suffering for the patients and their families, and it leaves the families with good memories and patients to die in comfort and little to no pain. So I'm just going to adjust this. So because of her brain tumor, she gained a significant amount of weight. So this was her before, and then this is her when she gained the weight. So she, in the video, it's about 6 minutes long, she described how she didn't feel like she was in her own body because she gained so much weight. Okay, so some people say that, why don't you just use hospice or the medications that you can get at the hospitals? But what a lot of people don't know is that the #1 cause of personal bankruptcy in the United States is medical bills. Many people cannot afford what it takes to keep them alive in their last months to year of life. So hospital inpatient care charges can exceed $6,000 per day. The cost to maintain someone in the ICU is about $4,000 to $10,000 per day and can go higher depending on the care needed for the patient. Hospice is a roughly $10,000 per month. Cancer drugs can range anywhere from $70,000 to $100,000 per year and can go higher. Physician-assisted suicide and euthanasia gives patients other options who know they are going to die but can't afford the medical bills and treatment to help keep them out of pain or treat their illness. So it comes up a lot with this topic that assisted suicide and euthanasia both go against the Hippocratic Oath. So the Hippocratic Oath is an oath stating the obligations and proper conduct of doctors formerly taken by those beginning medical practice. Parts of the oath are still used in medical schools today. So the Hippocratic Oath is an oath stating the obligations and proper conducts of doctors. It's taken at the beginning of your medical practice. The Hippocratic Oath states, "I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan." This means that doctors cannot give the drug to a patient or plan to intentionally kill them because they want to die or ask them to. However, a doctor is obligated to help a patient no matter what. So what a lot of people don't know is there actually is a modernized Hippocratic Oath. So the modernized version of the Hippocratic Oath was written by Louis Lasagna in 1964. He was the dean of the School of Medicine at Tufts University, and it states, "I will respect the privacy of my patients. Most especially I tread with care in matters of life and death. If it is given to me to save a life, all thanks, but it will also be my power to take a life." So when the original Hippocratic Oath was written, it was written around 400 BCE. At that time, there was no such thing as assisted suicide, but as society has changed, Science has become more advanced, and medical options have changed and become more advanced. So overall, with assisted suicide and euthanasia, people feel that they have more options for them. They don't feel as trapped as you witnessed from Brittany Maynard. She was in pain. So Brittany Maynard once said, "To have control of my own mind and to go with dignity is less terrifying. When I look at both options, I have to die. I feel this is far more humane." So thank you for watching my speech.